Dr. Ang actually said that roast pork, you know it's roast pork? It's good for the heart. You don't believe, right?
More Sioba or eat more McDonald's, I'll be more than happy to visit this doctor.
Welcome to the debut of Chat with Jen, the show where we turn the spotlight on interesting people doing interesting things and we deep dive into the questions you've always wanted to ask but never had the chance to. My name is Cho and asking questions today with me is Andy.
Hello everyone, my name is Andy Wu.
One question you might have is who are these interesting people and where do we find them? Well, in Jen, our team of financial planners meet with people regularly and ask them a lot of questions as part of the work we do.
Okay, so in simple terms, basically we are professionals, kaypos.
Yeah,
Okay.
professional, very kaypos.
I understand.
Because we're talking to so many people regularly, we often come across people doing interesting things, right? Like whether it's in part of their work, their hobby, or even volunteer work. And we just felt that, hey, these are stories that we really should bring out and share with people.
Okay.
And that is how Chat with Jen is born.
Oh, so it's like a chit-chat sessions on anything that's interesting.
Yes, if it's not interesting, we don't chat.
Okay.
Yeah. Yes, and speaking of something interesting, we have our guest today, Dr. Ang Teck Kee, ready to answer our questions.
Dr. Ang, okay.
Before I ask Dr. Ang to introduce himself, let me start by sharing with you how we got Dr. Ang into the show.
Because he's your friend?
No, it started, with our CEO Sean. Actually, he's not young already, getting in his stage,
Very mature now.
Yeah, quite mature already. Yeah, and when you reach that stage of maturity, what you want to do is go for a lot of medical checkup.
Of course, I mean...
Yeah, and he reached that stage whereby normal blood test not good enough.
Okay.
Need to do a comprehensive heart check.
Okay.
So because of that, he got to know Dr. Ang, who is a heart specialist.
Oh, heart specialist. Okay.
But he's not the only heart specialist in Singapore. But what caught our attention is that he has a very unique advice with regards to hearts.
Unique. That means not only he treat diseases, he treat heartache, or like I broke off with my girlfriend and he will treat me also.
That one maybe he can do also. But what is more unique is he tell you what to eat.
What to eat? Standard. I mean, MOH always have publicized on advertisement, that kind of things.
Yeah, the answer that caught our attention was that it's not on any MOH website. Dr. Ang actually said that roast pork, it's roast pork.
Sioba.
It's good for the heart.
It's good for the heart.
Yes.
Okay.
You don't believe, right?
Hard to believe, but it would be good if doctor asked me to eat more Sioba or eat more McDonald's. I'll be more than happy to visit the doctor.
I was thinking this is the doctor we must get.
Okay.
So from now on, my heart checkup, I go for Dr. Ang because he encouraged me to eat Sioba and who knows what else,
Yeah.
Yeah, but whether there's a myth or whether there's a truth, we got Dr. Ang himself to join us today. So maybe we can give a warm welcome to Dr. Ang.
Doctor, woohoo!
Hey, Dr. Thank you.
Bye-bye.
Nice to meet you.
Yeah.
Hi everyone. I'm Dr. Ang Teck Kee. I'm a cardiologist. Actually, that Sioba comment was just a joke. But sometimes cracking jokes is also a good way to get to know your patient better, and also get them to open up and relate. Because it makes you more relatable, right? I mean, if you first thing you step into a doctor's clinic, and then they start barraging you with what you already know, but you haven't been complying with, like all the dietary advice, all the exercise advice, then it just become another regular consult. It became a bit like what you call a bian fong, in Chinese, but English will be just half in,
half out.
so you don't really retain. So of course, like Sean has displayed, he only remembered the Sioba comment. But at least it was a starting point to get him interested. Because I think you all also know that all these so-called unhealthy food are generally part of the contributing factor to why we have coronary artery disease, as we call it. So I think you want to ask some questions regarding the heart here to answer your questions.
Okay. Hey, but before that, Andy, you want to grow a business now?
Grow my business. Why not? Of course.
Okay, from now on, when you see your client, tell them to buy more product. That's good for your financial plans.
True.
Then they say, why? I got your attention already, right? Then you talk about financial planning.
Okay, I
Thanks, Dr. Ang, for the idea.
Business.
But anyway, I think it's the first time some of us meet you, I think for our audiences as well. Could you start maybe with just a short introduction of who is Dr. Ang?
I'm actually a cardiologist. in private practice. Before that, I was actually working in the government hospital, restructured hospital. I graduated in 2004. So then became a specialist in 2011. Then after that, went Australia for further training for a year. Then I was back to serve out the remainder of my government bond. So I think roughly went to private practice in 2019. Yeah, so about 4 years now. Yeah, so I'm mainly based in Mount Elizabeth Hospital, but of course I can travel to any of the private hospitals if needed. My subspecialty is actually in what I call intervention, but it's actually got to do with like fixing your blocked pipes.
Oh.
Yeah, the heart is like a pump, right? So it's imagine it as an engine, right? So with an engine, you have electrical wiring, you have pipes, and also the structure of the pump itself.
So like a plumber.
Yeah, it's like a plumber. There are other people who have used that term before, but that's a useful way to explain it. If you have blocked pipes, I can fix it. But if you have electrical wiring issues, if it's too complicated, you need to get the person who is more subspecialized in that. In cardiology, we call those specialists electrophysiologists. So I'm an interventionist.
Wow.
So there's still differentiations.
Oh, there are actually a lot of subspecialty in cardiology.
Electrician, there's plumber, there's different.
Structural heart, a structural heart specialist, also adult and children, pediatrics. Yeah.
Wow. Okay.
And there's also imaging experts as well, like all your MRI hearts and.
So just the heart itself, there's different group of specialists already in a way. Okay. Well,
Just like financial planning, right?
Retirement specialists, educational. Okay, I understand. So anyway, thanks for sharing. So maybe we would like to know you in a deeper manner.
Okay.
So maybe I have some simple question for you if you don't mind.
Yeah.
It's a very simple question. So you just choose either one answer.
Okay.
Very quick one. So that we can get to know your personality a little bit better.
Okay.
Let's have fun now, okay?
No right or wrong answer.
No right or wrong answer.
Okay.
You just
Answer that makes our heart better or not.
yeah, and then we have an image of how Dr. Ang is. Okay, so simple question.
Yes.
So let's try. It's a get to know you session. So jogging or swimming?
Swimming.
Swimming. Alright, nice. Coke or bubble tea?
Neither actually.
Neither.
If you want Coke Zero,
Oh, Coke Zero. So it makes a difference.
because
No sugar. You believe in the Coke Zero thing? Some people say Coke Zero is the same or even.
okay, to me, I obviously not slim, right? So, I mean, everybody has a vice. That's my take on things. Just like the patient will come to you and tell you he smokes, and you're a non-smoker, and then we're not there to judge. We're there to help them on their journey, to maybe modify their risk factors. So just like for me, my weakness is probably food, as you can really rightly guess.
Alright.
So to me, the calorie must count. So I'm not going to waste
Okay, understand. So beverage is secondary. Okay. Let's move on. Another beverage I ask. Beer or wine?
Probably sake.
Oh,
Can you put sake in there?
sure. Okay, that's not inside my list, but it's something interesting. Okay, this one, talk about food.
Wow. Actually, it depends on the mood of the day, right?
Let's say a Monday.
Let's say now.
Right now.
I can go to Amoy and buy for you. Char-kway-teow, yeah.
With ham or without ham?
Oh, power.
With ham, alright. Okay, next one also killer move. Fried chicken wing or luncheon meat?
Don't really.
Not in your
They want waste calories.
Waste calories.
Okay, fried chicken wing. Okay, fried chicken wing.
Fried chicken wing, okay. McDonald's or Subway?
Subway.
Okay. Are you a day or night person?
Both.
Both.
Yeah.
Wake up early to work.
Wake up early to work, go to bed, a little bit late also.
Because at night is your me time.
Yeah.
Is it because the heart problems never stop day or night, right?
No lah, I need to spend time with the family lah. So night time is for family.
That's nice.
So earlier part of the night will be for kids. Then after that they're in bed. Then will be me and my wife lor. Stand talking or have a drink or go out.
Oh my god. Okay. Okay, this one more for tech. Are you a Facebook person or Instagram person?
I haven't used my Facebook for quite long.
Oh, so IG.
Also no.
Also no. Alright, okay.
Used to Facebook a lot, but then like I said, kids. So it's a lot of screen time, so I stopped.
Okay, got it.
I think since 2013.
I'm guilty of it also, so yeah. Okay, next question. 3 more. Tortoise or hare?
Tortoise?
Autis. Okay. There's a reason for this question.
Oh, okay.
Okay. Apple or Android?
Apple.
Apple. Okay. No.
It's Apple, right?
Yes, but I use Android phone, so you're not in my game.
I have an Apple phone and Android phone.
Oh, okay.
So best of both worlds.
Good patients
So
call me using Apple. Those not good ones, you call me.
Okay, last question. Manchester United or Liverpool?
I don't watch soccer.
Oh, okay.
I only watch the TV broadcast of the, because we're watching 90 minutes and sometimes if there's extra time, it's a bit painful.
Yeah.
So you watch the summary, it's just like F1, right?
Highlights.
You don't watch the entire race, you just watch the highlights. That's the most 精彩 part, people kick the goal in. So you just watch the summary all over.
So is it healthy for heart patients to watch soccer match?
Depending on what they're doing as a side when they're watching the soccer match.
The side.
I support a very good team called Everton. Every time I watch, my heart. Yeah, so should I stop watching?
I mean, if you feel that it's good for you, go ahead.
Okay.
I'm addicted to it, but it's bad for me.
Well, everyone got advice, right? So you don't one.
Okay, got it.
Okay,
No other vice.
at least no other vice, no smoke, no drink. Okay, I'll keep watching.
Okay. Anyway, thanks for joining us for a mini quiz session. I hope you had fun.
Yes.
So with that, okay, we have come to the next segment of our program today. So what we will do is to answer all the health questions.
Okay.
Okay,
Try
so-
to answer to my best ability.
Yeah. Okay. So not to scare you off, I think we have a lot of questions coming from all our clients. Because once they heard that, we have a heart specialist coming in, everybody, and we ask our clients, do they have any heart burning question they want to ask, consult a heart specialist? A lot of them point their questions. So we have a long list and we got very limited time.
Okay.
So to keep things simple, maybe do a Singaporean love lucky draw.
Okay.
So we decided to use our limited edition Gen deck to put all the questions inside and for you to draw.
you draw.
No, because I believe your fate depends on your your own hand. Yeah. So so what kind of question you get is depend on yourself.
How many times do I need to draw?
We keep going until time's up for this
until we are
segment.
happy. I think that's okay.
You're happy.
Okay, but I understand some question maybe tricky or don't have enough time to answer. So we are very nice one. Why? So you play Uno?
Yeah.
Yeah, you know what is reverse card, right?
Yeah.
So I prepared 2 reverse cards for you. So if there's a question that you think I don't draw, you want to draw 4 cards, I'll give you draw.
You draw 4, okay.
But these 2 is very simple one. So any question that I feel is too simple or too troublesome,
You just don't feel like answering.
Answering,
You
you answer.
answer.
Oh, is it?
yeah. So you got 2 chances. This one special power for you.
Yeah.
You all can answer.
Can.
You never know. Maybe we're
Call a
expert.
friend, call a friend.
Next time we play Who Wants to Be a Millionaire.
Okay, so let's start with our first question. Alright, 抽奖时间.
Hold on, okay.
Yeah.
Okay. Oh, okay. So first question. What are some regular care methods for the heart?
Regular care method. Well, I mean, generally we're talking about a healthy patient. I mean, assume healthy with no prior conditions. Yeah. So I would say even there's also guidelines, right, by Health Promotion Board, which actually is based on research that's done worldwide also lah. So generally they say about exercising 150 minutes to 300 minutes a week of moderate intensity exercise. So if you look at the minimum 150 minutes, then you look about, let's say you exercise only on weekdays, then it's just about half an hour a day lah, for the weekdays lah. Unless you're a weekend warrior lah. Then you do more at the weekend lah.
But the moderate.
Yeah, so the moderate intensity, that's an interesting question. So there are a few ways you can go and check moderate intensity. The first method you can use is just a quick search on Dr. Google.
Okay.
Just kind moderate intensity exercise. I feel that is actually the more practical way. You search moderate intensity, a whole list will come out. Then you choose activity that you like, rather than the doctor tell you what a moderate intensity exercise is, and then you think, I don't really like this. Then you might do it for a short while, and after that you're not interested. So you pick activity that you like. There's a whole list of it. So you can choose one. You do already, then you get tired of it. You can switch to the other one. Yeah, but that's one method. The second method, of course, is what I call the heart rate method. So a lot of us nowadays I don't wear a watch, but you have a smartwatch. So nowadays you can actually monitor your heart rate when you're exercising. So for moderate intensity, usually there's a rough formula. If you want to use the heart rate method, you can, there's this maximum heart rate for each patient, depending on age group. So there's the formula of 220 minus your age.
Okay.
That's the maximum.
220 minus our age.
Yeah, so let's say you're 40 years old and the maximum heart rate is 180 lah. But during moderate intensity, you don't need to hit 180. You can hit a heart rate maybe around 75% of that. So that's considered good enough. So you maintain it for half an hour lah. Of course, asking people to look at their watch while jogging is hazardous. I mean, or you might go into a
gym, right? Then
or if you're looking at the watch while running, it's a bit. So there's another method which I use to tell my patient is you can use the breathing method lah.
Breathing method.
Yeah, it's actually kind of is recognized also. They call it the Borg scale, BORG, like cyborg like that.
Oh, okay.
It's basically relative perceived exertion. So that means how you feel lah. So for example, maybe when you never exercise in your whole life, and then today you start walking briskly. That speed that you walk makes you chuan, right?
Yeah.
Breathless, sorry, using Hokkien here. Makes you breathless. So this breathless sensation, when you're feeling breathless, you cannot really talk properly. So a useful way is singing.
Okay.
Not asking you to sing, but if you find that you can still sing while you're walking, that is probably low intensity exercise because you need a full self. I mean, you need to be not so breathless, enough air in your lungs. Then and now, if you find that you can't sing, then probably you're in moderate range already. The way you're breathing. Then of course the high intensity part is you can't even talk.
you can't even talk. Yeah.
Or maybe it's monosyllabic answer. If your friend, jogging buddy asks you, want to go for a drink later? Yeah.
Yeah.
Then you keep going, right?
Oh, that's a very easy and practical way.
It's practical way, and in a way, it also helps because after a while, your body, the same amount of intensity you carry on for a few months, right? The same level of exertion will no longer make you so breathless.
So
Then you have to step it up
Understand.
to feel that
Level
kind
up.
of breathlessness again. Yeah. So 3 ways. So one is go and search, one is monitor your heart rate, then one is see how breathless you are.
Okay, so,
Oh, yeah,
so,
excellent.
so I go one step deeper. So what about those people with conditions? Can they still?
Yeah, they can. In fact, they can. In
So-
fact, you should. Even patients with previous heart attack, patients with weak heart
I said
function,
bypass before that
patients
kind
with
of thing.
bypass, they should all go for some
So
form of-
similar.
Yeah.
I see.
In fact, after heart attack or after bypass or patient with heart failure, sometimes we send them for this thing called cardiac rehab program,
Okay.
where they actually gauge how much they can do. In a way, it also psychologically helps them cross a mental barrier. Because a lot of patients, for example, after heart attack, they get scared
Correct.
of exercising.
Yes.
Any little discomfort,
Yeah.
which comes from maybe non-cardiac causes like musculoskeletal, then they stop because they think it's the next heart attack. So having monitored cardiac rehab programs allows them to understand their body better after they have event. And the exercise they push is monitored. There's a professional there monitoring you, then you can tell this is my level.
Okay.
Then from there on, because usually cardiac rehab sessions are over 1 month, or 8 sessions.
So after that, they know
So
how
after that, they
how
stop
they can
on their
push.
own, yeah.
Yeah.
Then
Okay.
they know already.
I see.
I mean, hopefully they are more confident.
Which is better to get? Singaporean very kiangsu, ah. So high cholesterol or high blood pressure, which one is better?
I think neither.
but let's say assume
Which one is worse for you
which
lah?
one?
For person, let's say high cholesterol or high blood.
I would say both are bad, but in our, I mean, right now for cholesterol and high blood pressure, both of them are readily treatable. Both of them, depending on how severe it is, you can actually like pull back depending on your underlying risk factor. For example, let's say talk about hypertension. You see the doctor and your blood pressure is elevated, but it's in a mildly elevated range because we've got different grades of hypertension, right? Mildly elevated range, then the doctor go through your risk profile, go through your lifestyle. Then after that determines that actually, yes, for this short period of time, we will bring down your blood pressure to achieve the good levels. But meantime, maybe you can work on the certain non-pharmacological aspect to bring down your BP. Then that usually, for example, talk about lifestyle changes, right? Weight loss, low salt diet. The physical activity that we're talking about generally can reduce your blood pressure on average 5 to 10 for the systolic part, around 3 to 4 for the lower region, the diastolic,高压低压. Yeah, so in a way, hypertension, if it's mild, well, I wouldn't say still okay, but that. But I mean, because a lot of patients when they come in and you tell them you have this, you need medicine, a lot of them forever. Then they sort of don't want to take, or they get a bit disheartened, and they see you once, listen to your advice, then leave, then don't come back.
Okay.
That's even worse, right? I mean, if they don't come back and see you, it's fine, see another doctor, at least you still get. But they don't even come back at all to see any doctor, then that's even worse. Cholesterol wise, I mean, depending on how high it is. If yours is mildly raised, at a little bit above the recommended level for your risk, then again, the same thing, lifestyle changes can reduce. But it also, because now cholesterol guidelines have been updated a lot. Yeah. The Singapore one is 2016, the MOH one, which is quite old. Now it's 2023, going to 24 already. So almost 7 going to 8, yes. So the one that was more recent is 2019, the European ones. American ones was 2018.
But Asian and
now
so basically, when even guidelines, even by the time guidelines come out, it's also a bit outdated already, because evidence keeps coming out, right? But at least guidelines is something for most doctors to at least have something to base on. So
the reference point.
Yeah. So by the time they come out with guidelines, it's already 1 or 2 years behind the data already. But it's better than nothing. So the more updated guideline recent is 2019, the European ones, or 2018 American ones. Of course, they are revising. So rather than follow older guidelines, 2016, we prefer to follow the newer ones. So like the newer guidelines all talk about cholesterol reduction based on individual risk. So there is individualization of treatment.
It's not like a one size fits
Not
all.
one target, everybody follow, that's it.
Okay.
Then in that case, robot can do also.
So it's not cater to each person needs.
In terms of your risk.
Understand. Alright.
I like that. So some people can eat more silk, but some better don't eat. So that's where the doctor is really coming from.
If you're talking about tongue in cheek, right? But technically it's low in sugar, right? So if you're diabetic.
Okay.
But I mean, that's just a joke.
Okay. Let's move on to the next questions.
Come.
Wow, someone question.
Yeah, we got
A lot of it, I mean,
a bag full of questions.
Oh, you want to answer too?
This one tag together.
Next.
Because
Okay.
one is a statement followed by a question.
Okay.
Very intelligent people.
Same with cholesterol. Our body does need cholesterol for a high immune system.
Yes, it does.
Will reduce cholesterol by statin lower our immune system?
That is not easy question to answer, because it's also based on immunology as well. It is not a simple answer that can be given in a short session like this, but I can try to understand. So, yes, you do need cholesterol. Cholesterol is a very broad heading. Under cholesterol, there's so many different components. There is your good cholesterol, the HDL.
Correct.
There's the bad cholesterol, the LDL. Then in between, you have all those triglycerides, which is also another cholesterol. You have your lipoproteins. You have your, I mean, I'm not trying to bore you in medical terms, like chylomicrons, all the rare cholesterol.
Okay.
I'm nodding as if I know, but actually I don't know.
Rare cholesterol molecules. So, in a way, that question whether you need cholesterol for immune system, yes, cholesterol is needed. You need cholesterol to synthesize things, right? You need it for cell membrane, you need it for nerve endings, you need to synthesize stuff. So, they also saw that for let's talk about maybe the LDL. So for patients with certain autoimmune conditions, like for example rheumatoid arthritis or those SLE, you know SLE?
Lupus.
Yeah, lupus.
Yeah.
Yes.
This one we know, we don't know.
So these are autoimmune where your body attacks itself, right? So in these patients, they have increased risk of getting plaque formation, and what you call atherosclerotic plaque formation in the body. And in these patients, the cholesterol, when it's not controlled, it makes it worse.
Okay.
So in a way, lowering, there were actually studies that were trying to show, in fact, as recent as 2 years ago, when you reduce cholesterol in these group of patients, you actually reduce the chance of plaque formation as well. I mean, other than the normal patients, when you reduce their cholesterol, you reduce the plaque formation. So immune modulation, and so they're autoimmune, right? So when the cholesterol is lowered, it actually lowers the chance of plaque formation in this group of patients with autoimmune disease.
Right. Okay.
So of course, it generates excitement because you can control
cholesterol.
You can control. Hopefully, you can control for this group of categories of patients, maybe the plaque formation will be less. However, that being said, there were also how of you may have read about cancer risk and cholesterol reduction, because you need certain components of the cholesterol, not the bad cholesterol, but certain components of the cholesterol to activate certain our body's soldiers. Our body soldiers got a lot. The T cell, B cell, among others. You need certain cholesterol components to activate their activity. So some of these cholesterol components are pro-inflammation. That means not good. Some of them are anti-inflammation.
Okay.
Good. So to your question, a bit hard to answer.
It's very broad.
Very broad. So I would answer in terms of atherosclerosis. You definitely need the reduction of LDL cholesterol
Okay.
to reduce your risk of
Heart diseases.
plaque formation
Plaque formation.
in any arteries. So that includes brain as well.
Okay. Okay. So next question. We have a lot of clients with question on high blood pressure.
Okay.
Is there any correlation with high cholesterol and high blood pressure? This seems to always come hand in hand.
Oh, the sun gao.
Sun gao, but this one don't have the diabetic.
I would actually, I wouldn't say there's correlation, but it's more to do with the subset of population that tends to have it.
Oh, okay.
Right. So, for example, a lot of times, let's talk about cholesterol and let's talk about high blood. High blood pressure, majority of the time, it's what we call primary hypertension. Around 80% of cases are primary hypertension, and then 20% are the secondary. So, what is primary? What's secondary? Is it like school? It's not. Right?
Yeah.
So generally for primary hypertension, it just means there are multiple unexplained, maybe multiple reasons why the pressure can get elevated. Like you're obese, you don't exercise, you eat a high salt diet, too much max. You eat a high salt diet and then you maybe got family history, and there's no one gene identified as multiple genes, right? So there are many causes. So those kind of patients, which is the run-of-the-mill type, you present to your doctor, most of the time you just get treated, and then they send you on your way. Then you get regular follow-ups for hypertension management in terms of medication tweaking and such. Then there's this other group, the secondary one, right?
Correct.
Where there is identifiable cause. You treat that cause, the hypertension goes away. Those are not common. For example, if you have a kidney artery narrowing, what we call renal artery stenosis, then the kidney, which is our waste factory, right?
Correct.
Salt water regulation, thinks the pressure is low, but the pressure is not, and you try to pump up the pressure, right? So you retain more salt water. So those kind of patients, if you treat the narrowing, the pressure comes down. Or if you have a certain hormone that is produced excessively because of certain tumor in your hormone producing gland, and these hormones that are produced are responsible for salt and water regulation, excessive amount, results in blood pressure elevation. You remove the tumor, blood pressure comes down to normal. So for the question of the high blood pressure and high cholesterol, these things come together. Yeah, so going back to that, so it's one big round. I'm trying to say that majority of the time, the 80%, so a lot of it is
Primary type. So they come together.
So let's say lifestyle, right? Most of the time it's lifestyle, right? So your diet is not good, you exercise, just one weight. Then tends to come together with cholesterol as well, which is not
come as a package already.
Right. So which is why digressing. There's some patients, there's some studies that they say, you take this drug, cholesterol, and then it's been shown to lead to increased incidence of dementia, increased incidence of diabetes. Yes, there is some evidence that certain statin, which is a cholesterol drug, have increased incidence of developing diabetes down the road. But statistically, when they analyze, they say it's not that significant. Compared to the bigger picture, is if you don't treat the cholesterol, then the chance of them developing more complications is higher. So it's pros and cons. So the argument can also be said that, well, in the first place, the fact that they're on cholesterol medication, you're not going to give them 20 years of cholesterol medicine and say, I see you in 20 years time, you're still alive. Come back and see me. You're going to give them a few months, come back. Few months. So these patients are already on regular monitoring. You're not just going to monitor them for cholesterol, right? Well, you can't, let's say you can't for hypertension. I'm not going to monitor your BP and bye-bye, I see you. Right? I'll probably monitor you as per recommendation, screen you for maybe sugar level, cholesterol level, not every month, not every 3 months, maybe once a year, see how you are. In fact, there's no real definitive frequency you should be monitoring. The ministry tried to say maybe 4 years.
Okay.
4 years, but there's nobody stopping you from checking every year.
Every year. Okay.
I mean, if you tell you, hey, you check every 4 years, then for you, maybe to you, too far.
4 years.
You want to check every year.
Mm.
Then you check every year, right?
Right.
So, when you have a certain condition and your follow-up for the condition, you tend to be screened for the others.
Okay.
And because they tend to be associated with certain lifestyle component,
Okay. Or you also
you
have
pick
this.
it out also. And then you end up, how come they all seem to come together? That's why it's uncomfortable.
Also, that's one reason why when we
it's
pick
always
out and we
together.
do more tests, then you also have this, but this all probably has the same primary causes.
Actually, you mentioned a keyword just now. It's the word salt.
Yes.
Okay, recently, I think there's an article about MOH. They say that.
Yeah, the salt in our food, right?
Correct. So they're
Very
going to
nice article,
regulate.
actually,
Yeah.
yes.
So does salt really impact heart?
It impacts BP.
So that indirectly they link to it.
Yes.
I see.
So that's why your french
but
fries is healthier than fish ball.
In simple,
No, it's not a joke in terms of salt content.
Fishball got more salt.
Yeah, the fish ball got more salt.
Oh, I still feel my kid here.
yeah. Hey, but in simple terms, why does salt affect the BP?
So why the salt?
In most simple terms, like
Salt and water comes together. I mean, it's the basis of all you put your cucumber around your eyes for your it's to draw out excessive fluid. So salt and water retention, your blood pressure goes up. Which is why if you notice if you exercise, after exercising your blood pressure is a little bit lower.
Oh,
During exercise, of course, the BP is up. lah.
Yeah, because the heart.
After you exercise, you go and check your BP, it tends to be lower.
Okay.
I see. So
Okay,
the key is sweat it out.
I see.
The key is to reduce salt in the diet in the first place. And yes,
Or if you want to eat a lot better, sweat more than necessary. Yeah.
Okay.
We have
So
time
maybe
for one more.
One more question.
Okay, no
Okay.
problem.
You ever use your reverse?
I think maybe
Yeah.
Dr. Ang enjoy answering questions.
Yeah.
He's on the run. On the run.
Later, you ask me a question, I reverse on you.
Okay.
Last one.
Okay, last question.
Okay.
Oh. Is it true that with age, a person will get chronic conditions such as high blood pressure and cholesterol, or any ways to avoid? So you straight away say no already.
I have very elderly patients that they come in and then you screen them, the arteries are clean. It's like, wow. Yeah.
Clear pipe.
Yeah.
Not Japanese, right? By any chance?
Singaporeans also have.
Okay.
Okay.
So it's not true.
So it's not true.
But of course, with age, there's increased exposure over time, increased incidence of you having dietary and lifestyle non-adherence, right? So
Okay.
all these things all come in.
But I mean, normally we say as you age, your muscle go softer, or it degenerate. Does that happen to the heart also as you age?
Well, I'm talking about if everything else is healthy. and
In a way.
Well, I mean, at the end, it's still
Muscle.
answers that have no questions that have no answers for.
I see.
Does your heart age? If everything else is healthy, I mean, it is a pump that is not stopping. If you stop,
It's 24/7.
so unlike the handphone, you can switch off.
Correct.
You can't switch off the heart unless you're gone. So it is always constantly working. It's just like our cells are always regenerating. So every part of our body is always regenerating.
Okay.
So the reason why we have dust is also because of dead skin cells, right? Flick off, and then
Then grow
after
again.
you have dust. So every part of our body, the heart also regenerates.
Right.
Okay.
So the heart regenerates. So you talk about lifespan, we don't live forever. Right? So why do people die? Right? Because there is, I mean, we were taught in biology, and that's quite a long time ago, that there's this thing called telomeres. I mean, it's a kind of,
The longer it is,
it will get shorter and shorter and shorter with each cell cycle until it reaches end, and it's no more.
So it's a bit like the handphone after the battery life, after you charge very
no use, cannot charge.
yeah.
Happened to my shaver and stuff like that.
Okay.
So yeah, I mean, if you're elderly, it doesn't mean you are. What was the question? It doesn't mean that
It comes with age,
yeah,
basically.
age,
basically, that was never part of the equation. When I tell patients, say, why do I have this blockage in the artery? I never say age.
Okay. Well, anyway, thank you for answering all the health questions. But I mean, since I'm an MC here, I want to jump the queue. I got one question for you. So let's say a friend of mine who got a heart condition before.
Yes.
Can they take excitement? Example, I go theme park. I take extreme sports. Can they do that actually?
Probably not.
Probably not.
Because if they're, like you say, they're heart conditions, and I'm assuming you got a lot of medications, right?
Okay.
And some of these medications are blood thinners, right? So if you're going to go into extreme sports,
Let's say roller coaster, I go USS. So not encouraged.
you have to go roller coaster. I mean, even myself with no problem. I go roller coaster also can't take it. So,
Okay.
so I mean, it's I would say it's in. There's nothing stopping you from assuming your heart function is still normal.
Okay.
Yeah, there's nothing stopping you from having some excitement. But
Okay.
as with anything, it's always at own risk.
Moderation.
Okay.
I mean, your roller coaster is like driving on Singapore roads.
Especially
Pretty exciting, right?
peak hour.
Yeah.
Cross the ERP also. Scared also. Yeah. So.
Yeah, sometimes the price.
Alright. Okay. And so we have come to the end of the first segment. Thank you so much.
Yeah, no problem.
So we'll move on to the next segment.
Okay, for some
yeah.
time.
Yeah. You know, Dr. Ang, we asked you to come all the way here, but you also know we are a financial planning organization.
Okay.
So what we want to do is also ask you some questions around finance. We know you're not the expert, but we really like to know, how does a heart specialist think about money?
Think about money.
Yeah. You can reverse them also in this case.
Well, I mean, my wife sent me a message 2 days ago. It was by the Singapore government actually.
Huh?
Your basic, what's the thing?
Basic retirement sum.
No, it's a basic financial planning, right?
Oh.
Straits Times. It's quite nice. Nice summary. I wish somebody told me that when I was younger.
Okay, now we like to find out what you wish you're going to tell your children now that they are much younger. So let's cover some of these questions.
So if you are starting all over again, what I will get is probably because when you're young, you have time. I mean, assuming you don't die suddenly, you have time, right? So it's time you should make use of that. So you should, before you get any disease and condition that will cause a lot of exclusions, a lot of riders, you should get at least some basic insurance cover for yourself. So maybe a critical illness plan will be useful. If you are limited by budget, then maybe try to get a term critical illness cover at least. Then of course death cover is useful because when you buy young, your cost is low. The older you get, the more disease you get, then harder to buy, more expensive to get also. So probably what I'll get for myself will be if money is a concern, a term plan. Term plan for death, TBD, and critical illness.
Will you encourage yourself, let's say you're back to young age again, to get early stage?
I would say probably these are all good to have, yeah. But the most basic essential is death, TBD, and CI. Because there are a lot of good things that you can have. You can have early stage. You can have even work injury,
accident plan.
No, as in you can't work, then you get a disability income. These are all good things to have, which you can add on as you get more financially advanced.
Okay. This one no need to draw. I already have planned out the questions for you. Nothing complicated. The first one. What investment is the worst for the heart for 2023? China stocks or bonds?
I'm no expert.
Must call the financial advisor for.
I will ask Sean.
Okay.
You like that?
Ask Jen.
Okay. Ask Jen.
Another one. Which is a better investment for the heart for the rest of this year? Japan or Turkey?
Let's choose one country.
Just choose one country lah.
Your gut
So I'm
feel.
talking about money or for?
Investment.
If you want to put money there,
investing in Japan or investing in
No, I
Turkey?
don't follow.
you from the market.
So I ask that.
I think you
Ask
choose
the
Japan.
experts.
You know why? Because you drink sake.
Yes. Yeah. Okay, but this one you will know. It's your own personal attitude. When it comes to loans,
Yeah.
are they good or are they bad?
Like what?
Loans, borrowing money.
Well, I mean,
What's your personal?
you depends on what you're taking a loan for. If you're taking a loan for growing your business, taking a loan to get maybe a place of residence, but of course you also need to live within your means. So there are experts out there that can calculate for you whether the loans you're taking is too much for you to shoulder, like it's too much of the income. Then of course you need to tail down your expectations. I mean, you might want to aim for a GCD, but probably aim for something. You know what I mean?
Understand.
So loans, it's not bad. Useful thing to have, especially Singaporeans are a lot of time cash strapped but asset rich. So the loans is useful. But loans is a bit like advanced. It's a bit like getting the money for the future. I mean, it's like
The future
you
stuff.
probably can get that sum if you work this number of years, but the bank has or whoever has passed you the money first, then you pay off with time.
So okay to take loans,
Yeah,
right? Make
yeah.
sure it's for the right reasons.
Right reasons and
Everything
you
your
can
means, yeah.
afford the loan payment.
What is one piece of financial wisdom that now that you also have been through a bit of life experiences that you would like to share?
But I was brought up in a setting of savings. My parents they always were the young savers club, OCBC and all that. So saving, and being frugal, live within your means. So I guess the best advice is you should save. Maybe like the Straits Times article that appeared 2 days ago, you should have enough savings to cover you for about 6 months of expenditure in case of rainy day.
Okay, well, time flies.
Yeah, I think we have
Time
almost come
flies
to the
when
end.
we're having fun, right? And we are coming up almost to the end of our chat with Jen session. Just one last question for you.
Yes.
As you think about your career to now, as a heart intervention.
Intervention.
I think in my language, you save lives.
I hope I try to.
Yeah. Can you share with us maybe just like one story or one experience that you find has been most meaningful that really defines what you do up to now?
Most meaningful. I think all of them are meaningful. It's a privilege, to be brought within the. You watch those movies, right? What's that one? The one that Robert De Niro one. This is the circle of trust. This is outside the circle of trust. Robert De Niro. So basically, you are brought into the circle of trust, right? Where the patient come to you when they're vulnerable to seek help. So that is a privilege, really. So then you journey with them on their journey. Then somewhere along the way, you exit that journey. Either they get better, or maybe they don't make it because part of the disease process, or maybe they decide to get opinion elsewhere. In which case, you wish them the best, and then you know that they're in better, capable hands, and they carry on now. So I would say all the journeys are memorable, but sad ones, of course, there are a lot. I remember quite clearly the saddest one was there's one a child that came in, collapsed during PE lesson. So that was in the restructured days. So our hospital I was from KTPH. We don't handle pediatrics. So by right, all pediatric cases get diverted to KK. But this one was because it has collapsed. The child has collapsed. So brought into A&E for resuscitation. Didn't make it, despite long hours of trying to save. And then we even brought in the support team. Try to bring the child back. It was only 7 years old. Yeah. Then 2 weeks later, the grandmother came in. But that was because of what you call broken heart syndrome.
What is a broken heart syndrome?
It's a stress cardiomyopathy. It's a Japanese term. It's called takasubo. You know takasubo, right?
Which means you support a very lousy football team until you cannot take it, then you will.
Well, it's basically severe stress, either emotional stress or
trigger from the mental.
they can weaken the heart. So came in with heart failure symptom. We thought it was heart attack. They did an angiogram. Actually, nothing found, but the heart enzymes are elevated, so there is damage. The ultrasound, the heart is weak. Then we only on questioning then realized the grandma of the child.
That's where you all connected the dots.
Yeah. So then after that, of course, she recovered. The heart function eventually went back to normal. But yes, that was sad. Yes.
On that note, not the sad note, but really we would, on Dr. Ang's wonderful sharing. I think we are all grateful. That's number one. I think that's very important, and also for his time to come to share with us. I hope all of us took away some small nuggets around medical, but also to know Dr. Ang as a person. So thank you, Dr. Ang, for coming by our office.
welcome.
Thank you so much, Dr. Ang.
Thank you.